Frequent dizzy spells or constant dizziness can significantly affect a patient's life. Dizziness is one of the more common reasons adults visit their doctors. But dizziness rarely signals a life-threatening condition. Treatment of dizziness depends on the cause and the symptoms. It's usually effective, but the problem may recur.
I felt off in my head for a few days, then woke up with everything spinning and nausea. I couldn't even walk to the bathroom. The worst lasted all that day. Now 4 days later, and still super off, dizzy, and vision is weird. I am basically stuck in bed. I have very loud ringing in my right ear and it feels clogged.
Dizziness is a feeling as if the surroundings are spinning around, sometimes accompanied by nausea, vomiting, and ear problems. People experiencing dizziness may describe it as any of a number of these sensations: a false sense of motion or spinning, lightheadedness or feeling faint, unsteadiness or loss of balance, a feeling of floating, wooziness or heavy-headedness. These feelings of dizziness may be triggered or worsened by walking, standing up or moving the head. The dizziness may be, as told before, accompanied by nausea or be so sudden or severe that one needs to sit or lie down. The episode may last seconds or days and may recur. Patients with dizziness must be careful performing following acts: changing position, head turning, coughing, urinating, standing suddenly after eating. Dizziness is a common problem in the elderly. It is often associated with medication use and other conditions. Note that it can increase the risk of falls. There are 4 questions that you need to ask before making a diagnosis. Question number 1. Ask the patient about numbness in fingers and toes or around the mouth, anxiety or depression, headache, double vision, loss of hearing or ringing in the ears, loss of strength or sensation, lack of coordination, nausea or vomiting, palpitations, and blood in stools. Question number 2. Ask the patient about family history of any of these conditions: anxiety or depression, migraine headaches, hypertension, diabetes mellitus, ear disease, cardiovascular disease, anemia, Meniere's disease, nervous system disease. Question number 3. Ask the patient about how long he or she have been experiencing episodes of dizziness. Also ask how long each episode typically lasts. Question number 4. Ask the patient about use of medicine, especially alcohol, aspirin, blood pressure medications, diuretics. Physical examination. Following examinations are important for the diagnosis: blood pressure, hearing tests, thorough eye exam, thorough examination of reflexes and movement. Also ask the patient to exhale while holding her/his nose and mouth shut, or to hyperventilate for 2 minutes and turn the head from side to side, to see if these activities cause dizziness. If the patient is suffering from typical symptoms like weakness, lack of coordination, double vision, numbness, sometimes occurs after injury to important brain structures. The cause can be central vertigo.
Vertigo is a sensation of rotation or movement of oneself, called subjective vertigo, or of one's surroundings, called objective vertigo, in any plane. Central vertigo may result from diseases of the vestibular centers or pathways in the central nervous system.
If the patient is experiencing vertigo that occurs after changing position, turning the head, the cause can be positional vertigo.
Positional vertigo is often a result of diseases of the inner ear.
If the vertigo occurs before headache, the cause can be migraine-associated vertigo.
Migraine is a familial, recurrent syndrome characterized usually by unilateral head pain, accompanied by various focal disturbances of the nervous system, particularly in regard to visual phenomenon, such as scintillating scotomas. Migraine can be classified as classic migraine, common migraine, cluster headache, hemiplegic migraine, ophthalmoplegic migraine, and ophthalmic migraine.
If the patient is having sudden attack of nausea, vomiting, vertigo, the cause can be labyrinthitis.
Labyrinthitis is an inflammation of the inner ear that is often a complication of otitis media. It is caused by the spread of bacterial or viral infections from the head or respiratory tract into the inner ear.
If the patient is having recurrent attacks of nausea, vomiting, ringing in the ears, trouble hearing, vertigo, the cause can be Meniere's disease.
Meniere's disease is a condition characterized by recurrent vertigo or dizziness, hearing loss, and tinnitus, which is a roaring, buzzing or ringing sound in the ears.
If the patient has chronic and progressive loss of hearing in one ear, ringing in the ears, occasional vertigo, the cause can be acoustic neuroma.
An acoustic neuroma is a benign tumor involving cells of the myelin sheath that surrounds the vestibulocochlear nerve, the eighth cranial nerve.
If the patient is having lightheadedness, no vertigo, tingling in the fingers and mouth, the cause can be hyperventilation.
Hyperventilation is abnormally fast and deep breathing, the result of either an emotional state or a physiological condition.
If the patient has lightheadedness, no vertigo, dizziness occurs when making a sharp turn or after eating, the cause can be giddiness with sensory deficits. It is more common in the elderly and diabetics. If the patient is having lightheadedness, no vertigo, sometimes blood in stools, the cause can be orthostatic dizziness.
Orthostatic hypotension, also called postural hypotension, is a form of low blood pressure that happens when you stand up from sitting or lying down. It is more common in people with anemia or heart disease or those taking blood pressure medications, may involve a loss of consciousness.
If the patient has lightheadedness, no vertigo, the cause can be dizziness during certain activities. Dizziness occurs only with certain activities, like when urinating or coughing, or after eating. If the patient has dizziness and ringing in the ears, the cause can be drug overdose.
Dizziness that occurs after taking too much of a medication or drug, such as alcohol, aspirin, or sedatives.
If the patient has dizziness, double vision or decreased vision, the cause can be eye problems. If the patient has decreased hearing, history of recurrent ear infections, the cause can be chronic ear disease.
Two common types of chronic ear disease are chronic otitis media and cholesteatoma. Chronic otitis media is an ongoing problem with fluid or infection in the middle ear. A small tube called the eustachian tube connects the ear to the throat. The eustachian tube drains fluid from the middle ear and circulates air to help keep even pressure on both sides of the eardrum. Infections can block the tube, which keeps it from draining. This causes pressure and fluid to build up in the ear. Cholesteatoma is an abnormal growth of skin in the middle ear. It can be caused by ongoing pressure problems in the middle ear, frequent ear infections, or by a problem with the eardrum. Over time, the growth can get bigger, damaging the tiny bones of the ear. This can cause hearing loss. Without treatment, cholesteatoma can continue to grow and cause dizziness, permanent hearing loss or loss of control over some of the muscles in the face.